Good day, everyone. Today, our group will be presenting the muscles found in the anterior thorax based entirely on Tortora's principles of anatomy and physiology. In this presentation, we will discuss the location, anatomical features, and functions of each muscle, along with their importance in movement and respiration. We hope that by the end of our discussion, you will have a clear understanding of how these muscles work together to support breathing and upper body motion. So first, let's have our introduction. For our introduction, the anterior thorax is one of the most important regions of the body because it contains muscles responsible for breathing, posture, stabilization of the pectoral girdle, and movement of the upper limb. These muscles are essential not only for the respiration but also for daily functional movements like lifting, pushing, and reaching. Tortora categorizes the anterior thoracic muscles into three main groups. First, we have the muscles that move the pectoral girdle, such as the pectoralis minor, serratus anterior, and subclavius. These muscles stabilize and position the scapula, allowing efficient movement of the upper limb. Second, we have the muscles of respiration, including the external intercostals, internal intercostals, innermost intercostals, and the diaphragm. These muscles are vital in ventilation by altering the size of the thoracic cavity to allow the air to move in and out of the lungs. Lastly, we have the muscles that move the humerus, represented by the powerful pectoralis major, which contributes to major arm movements such as flexion, adduction, and medial rotation. To summarize our introduction, the anterior thorax muscles are grouped according to their primary functions: those that move the pectoral girdle, those that enable breathing, and those that move the humerus. Understanding these divisions help us appreciate how each muscle contributes to coordinated movement and respiration. Now, before moving to our lesson proper, let us first read our learning objectives. First, identify all muscles located in the anterior thoracic region based on Tortora. Second, describe the anatomical location of each muscle in relation to surrounding structures. Third, explain the primary functions of each muscle, including movement, respiration, and stabilization roles. Fourth, differentiate muscles that move the pectoral girdle, those that assist in breathing, and those that move humerus. And last, recognize the clinical relevance of major anterior thoracic muscles, especially the diaphragm and serratus anterior.
Muscles of the thorax that move the pectoral girdle. Pectoral girdle is a set of bones that attaches the upper limbs to the eggshell skeleton. The main action of the muscle that move the pectoral girdle is to stabilize the scapula so it can function as a steady origin for most of the muscles that move the humerus. Because scapular movements usually accompany humeral movements in the same direction, the muscles also move the scapula to increase the range of motion of the humerus. For example, it would not be possible to raise the arm before the head if the scapula did not move with the humerus. During abduction, the scapula follows the humerus by rotating upward. Muscles that move the pectoral girdle can be classified into two groups based on their location in the thorax, the anterior and posterior thoracic muscles, but we will be focusing on the anterior thoracic muscles, which include subclavius, pectoralis minor, and serratus anterior.
Subclavius. The subclavius is a small, cylindrical muscle under the clavicle that extends from the clavicle to the first rib. It steadies the clavicle during movements of the pectoral girdle. It is located at the rib 1 or first rib. Its function and action is to depress and move clavicle anteriorly and helps stabilize pectoral girdle.
Pectoralis minor. The pectoralis minor is a thin, flat triangular muscle that is deep to the pectoralis major. Besides its role in movements of the scapula, the pectoralis minor muscle assists in forced inhalation. Its location or origin are in ribs 2 to 5, 3 to 5, or 2 to 4. Its function or action is to abduct scapula and rotates it downward. RMA elevates rib 3 to 5 during forced inhalation when scapula is fixed.
Serratus anterior. The serratus anterior is a large, flat, fan-shaped muscles between the ribs and scapula. It is so named because of the sawtooth appearance of its origin on the ribs. Its location can be found on ribs 1 to 8 or ribs 1 to 9. Its action or function abducts scapula and rotates it upward. It elevates ribs when scapula is stabilized, known as boxer's muscle because it is important in horizontal arm movements such as punching and pushing.
For Section B, we will discuss the muscles of the thorax that assist in breathing. Breathing involves changes in the size of the thoracic cavity, and these changes are produced mainly by the intercostal muscles and the diaphragm. According to Tortora's principles of anatomy and physiology, the intercostal muscle groups include the external, internal, and innermost intercostals work together to move the rib cage during inhalation and exhalation. The diaphragm, meanwhile, is the primary muscle of respiration and is responsible for the most of the airflow during quiet breathing. These muscles are responsible for changing the size of the thoracic cavity during breathing. They elevate or depress the ribs and control the movement of the diaphragm, making inhalation and exhalation possible. So first we have the external intercostals. According to Tortora, these muscles form the superficial layer between the ribs and consist of 11 pairs. Their fibers round downward and forward, similar to the direction of your hands when placed in your pockets. When they contract, they elevate the ribs, which increases both the anterior-posterior and lateral dimensions of the thoracic cavity. This action is essential during quiet inhalation since the external intercostals are responsible for about 25% of the air that enters the lungs during normal breathing. Because they lift the rib cage, they assist the diaphragm in expanding the thoracic cavity. When they relax, the ribs move downward again, allowing passive exhalation to occur. Tortora also highlights that the external intercostals help maintain the spacing between the ribs and that their fiber direction is opposite to the internal intercostals.
Moving forward to internal intercostals. The internal intercostals lie deep to the external intercostals and run downward and backward between the ribs. They pull the ribs together to depress the rib cage, reducing thoracic volume. These muscles are active during forced exhalation, such as coughing or vigorous breathing, but not during quiet breathing. Location: situated deep to the external intercostals, muscle fibers run downward and backward at right angles to the external intercostals, extend from the sternum to the angles of the ribs, and attach from the rib above to the rib below. Functions: draw the ribs together, depressing the rib cage. Decrease thoracic cavity volume to push air out of the lungs. Active during forced exhalation, for example, exercise, coughing, and forceful blowing, and not used during quiet or passive exhalation. Additional key points in internal intercostals. First is deep layer of intercostal muscles located just beneath the external intercostals. Fibers run downward and backward, perpendicular to the external intercostals. Contraction pulls adjacent ribs together, narrowing the intercostal spaces. Depresses the ribs during forced exhalation, for example, coughing, blowing, and vigorous activity. Reduces thoracic cavity size to help expel air. And lastly, works together with the innermost intercostals to assist in active exhalation. Today, we're going to explore the innermost intercostal muscles, the deepest layer of the intercostal muscle group. These muscles sit in the spaces between the ribs, laying deep to the internal intercostal and the neurovascular bundle. The innermost intercostal play an important role in breathing, especially during forced expiration. The innermost intercostals help pull the ribs downward and inward during forced expiration, reducing chest volume and helping push air out.
Next, we have the diaphragm, which is the primary muscle of respiration. The diaphragm is a dome-shaped sheet of muscle separating the thoracic and abdominal cavities. It is the primary muscle of breathing. When it contracts, it flattens and increases the thoracic cavity's vertical dimension, producing inhalation. When it relaxes, it returns to a dome shape, helping the body exhale. Its location is a dome-shaped skeletal muscle forming the floor of the thoracic cavity and separates thoracic and abdominal cavities. It is attached to xiphoid process, inferior 6 ribs and costal cartilages, and lumbar vertebrae via cruca. Because of its essential role, the diaphragm is considered the most important breathing muscle. Any injury or paralysis of the diaphragm can seriously affect breathing since it contributes to most of the air movement during quiet respiration. Its functions are primary muscle of inspiration. During contraction, dome flattens, thoracic volume increases. Creates negative pressure, will lead to air enters lungs. Responsible for the 75% of airflow during quiet breathing. And during relaxation, dome rises, which causes exhalation.
Pectoralis major. Its location can be found on the large, superficial chest muscle covering the upper thorax, which originates from the clavicle, sternum, and costal cartilages of ribs 2 to 6. Its function is through flexes, abducts, and medially rotates the arm at the shoulder joint. To conclude this report highlights the complexities surrounding the topic of the thoracic anterior. The information provided serves to enhance our understanding of the function and significance of these muscles, particularly on the thorax anterior. This table summarizes the muscles of the anterior thorax, which classified to number 1, muscles of the thorax that move the pectoral girdle, which includes subclavius, pectoralis minor, and serratus anterior. Second, the muscles of the thorax that assist in breathing or respiration, which includes external intercostals, internal intercostals, innermost intercostals, and diaphragm. And lastly, the muscles of the thorax that move the humerus, which include pectoralis major.
This concludes our presentation and thank you for listening.